Hello, I'm David with Vascular Anesthesia,
I'm Crystal with Vascular Anesthesia.
and this is Insomnia.
I fell asleep last night, got teardrops on my pillow. I have no peace of mind, and this might never change.
So today we're going to have a topic about some things that goes on in anesthesia. First, we want to start with the profession of anesthesia. How do you feel about the profession of anesthesia and the direction that it's going in?
So I think that anesthesia is I think it's actually like a hidden gem. You know, a lot of people know about, nurse practitioners and, doctors or whatever. But, when you talk about anesthesia, you hear anesthesiologists. And you really just, think, a lot of people just think doctors, but, they don't know that there are nurse anesthetists that are independent. They can work independent. And, we are independent practitioners. And, I think it's a hidden gem that, not a lot of people know about.
And they perform, I think, over almost 90%, 93% of the surgeries is done in the United States. I think profession moving forward is moving great.
Yeah.
But a couple of things we would like to open up about the profession is more minority involvement in the profession.
Mm-hmm.
You want to elaborate a little bit on it?
Right. So I'll just start by telling a story. In my anesthesia class, there were 122 people, and there were only 8 Black people. I think I remember maybe 4 Hispanic people and, a couple of Indian people and, Asian or whatever. But there were only 8 Black people out of 122 people. And all of us applied to multiple schools, to get in. I think the minimum was probably at least 3 to 4 schools.
Yes.
And my program was one of the programs that took the most students.
So ratio-wise, I think when I went in Florida, it was 2 African Americans, of course, one. We had a guy, Pakistani guy. We had a Dominican,
Mm-hmm.
and I think one from Dubai, and then 2 Asians. So
Mm-hmm.
no, 3. So I think the minority presence, it needs to be increased in the world of anesthesia.
Yeah.
I think that if we keep pushing this field, I think we'll have great results.
Getting more exposure, the profession in itself is an amazing profession.
Mm-hmm.
The payoff for going to school. I remember doing research and trying to figure out, do I want to go to school to be a nurse practitioner or do I want to go to school and be a CRNA? And the time in school, it's just about the same. But, when you start talking about the pocketbook and those coins.
The bag is good.
The bag,
Yeah.
yes.
Yeah.
It's good and it just makes sense. Like at the very least, you're going to make 3 times the amount of money that you made as a floor nurse. And that's just if you work your regular shifts, not even talking about any extra shifts.
And then if you work for a group, opportunities like vascular, we're a little different over here. You go to some hospitals, MD Anderson, you go to USAP.
Yep.
You're going to be followed by a group of anesthesiologists, which is great. But here at Vascular, you're able to practice on your own. And when you go to the hospitals, these UT groups, USAP, Texas Anesthesia, great groups. Nothing bad to say about them. But at over there, they have a Gucci bag,
You absolutely
We got a
right.
Chanel bag over here. So, I think everybody's...
You just increased.
Yeah,
You
yeah.
just increased.
God bless us. Increased.
Yes, you just increased.
So we got a Chanel bag over
Yeah.
there. So that's why pushing the profession is something that's going to be great for the future of anesthesia. So, I love the direction we're going in. So.
Yeah, I think so. The exposure and then like you said, if you don't know the difference between a Gucci bag and a Chanel bag, you might want to go and Google, because we're talking about maybe 4 digits compared to 5 digits. You know,
yeah,
the increase.
Yes, the increase.
The increase.
Yes. We need an organ when you play that. Yeah, the increase.
We need an organ because the increase is there.
The double C is there.
It is there.
Yeah.
And what vascular is doing is helping to reset the market.
There it is. You stole the words out of my mouth.
Reset the market.
You stole the words out of my mouth. When we first started, I think that's what we wanted. We wanted to push the market.
Mm-hmm.
So if we allow these hospitals, we allow these huge anesthesia groups to come in and pay us less, we have no other alternative.
Right.
But to do what we're doing and reset the market and reset the value of us.
Right.
And when we first set up the whole pay thing, with HR and everything, we want to be above market on everything that we do.
Mm-hmm.
We want, of course, the best practitioners to be with us, but we want everybody to be compensated well.
Right.
Not only compensated well, we give you the best insurance we can offer, Blue Cross Blue Shield.
Right.
And retirement plans.
Right.
And it goes on from there. So I think we've reset the market, and I think we've done great for not just Texas. We've reset the market for Colorado. We've reset the market for Florida, Georgia, Indiana. We headed to New York, Missouri, Tennessee. Yeah, you naming things that I forget. Mississippi.
Mississippi.
Old Mississippi. Yeah, we done reset the market in Mississippi. But we love the direction we're going in.
Yeah.
So.
Oh yeah. Just, as anesthesia providers, you have to, remind yourself sometimes of your value.
Mm-hmm.
And, like I said before, if you don't know the difference, look up the difference between an independent practitioner and a dependent practitioner, because we're independent practitioners, and it means something, and it increases our value tenfold. Hundredfold.
Whole
lot.
Blessings on blessings.
Chanel bag. Gucci bag.
Yes. We are Vascular. We provide anesthesia services for office-based anesthesia, ASCs, and even small hospitals. Thank you for the opportunity that you allowed us to come in to your families to service you while you're sleeping with excellence. Thank you. We are Vascular.
We are Vascular.
I fell asleep last night, watching drops on my pillow. Drops on my pillow.
So, how do we push this profession? Easy. We keep motivating. We keep educating. We have practitioners just like Crystal that's on board. We have a Dustin that's in Colorado. We have Bob that's in San Antonio. We have Albert Calvin who's just doing these great things even with his company in San Antonio. We have Doc Flanagan I can't even speak enough about this guy.
I mean, he wrote a book.
He wrote a book. He's taking African American men and molding them into something that we haven't seen any man do anything like this.
Right. And helping them reach their potential.
Yes, and pushing them and showing them that, hey, it's something besides picking up a ball.
Right.
It's something besides taking orders, and that's basically how probably our parents raised us, so we won't have to take orders from, everybody. Or anybody. But Doc he's on another level.
Right.
Like this guy.
His story is amazing.
Oh man, author, motivator, educator, Columbia University ties. This guy he's amazing, and look him up. Look him up on Instagram, Doc Flanagan. I'm telling you, he's doing some amazing things, and he's a blessing to
really impressive.
Vascular. He's a big blessing to Vascular. So
Look him up on Instagram. Look him up on Facebook. Go buy his book. So he's not paying me to do this, but
He's not.
he's such a good guy. He should be honored, and you know we honor him today. So let's talk a little bit about Vascular and how we are
we have community ties. So we're going to go on a radio station pretty soon. We're going to give away a lot of gift cards. What other anesthesia companies doing that?
None.
None.
Because
Zero.
They're unseen.
Yeah. So we have community ties. We're going to radio station. So it may be a 9 at 9. We're going to give away $25 gift cards, $50 gift cards, $100 gift cards. We're going to give away backpacks. We're going to give away. We missed the school supplies, but last year we did turkeys.
Yeah.
We're going to do the same thing this year. We're going to continue to bless families. We're going to continue to bless this profession. We're going to push it because we have this great opportunity to help the community, because we are a small company and it's a minority-owned company.
Yeah.
So we don't know who owns it, but
We don't know who owns
but
it.
that guy, the group, they're doing a great job at helping the community out and putting back into the community. Toy drives, food drives, radio station giveaways, educating people about the profession, about anesthesia, and just grooming men and ladies and pushing them to their potential.
Yeah, that's one of the good things about vascular, because as big as it is getting, from when I first started to where it is now, it's always had a very small feel, and you always feel like they're trying to reach out and help others. Just like there's a lot of minorities that works for vascular. We're telling you that there's not very many of us there. This is trying to vascular is trying to lend itself to give exposure to anesthesia, the world of anesthesia, how to get here. And you can't do it if you're not out there talking to people and you're not out there helping the community and being seen. And so it's just their way of trying to like you said, give back and make anesthesia and help people reach their potentials, or potentials they didn't even know were possible.
And it's great when you can have yourself, you can go to another woman of color and have the conversation about going to sleep. Have the conversation about, we're going to take care of you during your procedure. It's great when I can walk in and say, hey, look bro, you're going to be well taken care of. I'm not leaving. I'm going to be there by your side, and you can trust me. So once we have people who look like us, talk to people they're having surgery on that look like us, I think it's a feel of family when you go to sleep. Because when I'm looking at a lady, I'm taking care of my mom, or father, or grandfather, or uncle. And we have these people that are working with us like that. Like we were talking about Doc Flanagan, we have Ladarius Crossley, we have Rod Nelson, we have yourself. We got Janice down the valley. It's
twins.
The twins, Shanitra and Salitra. They always doing TikTok.
Yes.
And they educating the community about COVID. They educating the community about anesthesia. They even went on the
Tamron Hall.
Tamron Hall. They went on her show, and they spreaded the news about anesthesia.
Yep.
And
she's big time.
yes, so it's a great thing. They're in the. They have several businesses and great things.
Yeah.
So we're doing great things over here. We want to continue to do it. We are vascular. We provide anesthesia services for office-based anesthesia, ASCs, and even small hospitals. Thank you for the opportunity that you allowed us to come in to your families to service you while you're sleeping with excellence. Thank you. We are vascular.
We are vascular.
I fell asleep last night, watched it drop, soaked my pillow, drops on my pillow.
Okay, so let's talk about some of our induction medications. And when we talk about induction, that means the process of putting you to sleep, the process of, getting you off into dreamland, the opposite of insomnia. So one of the drugs that we like to use is ketamine. Ketamine is a really, really powerful drug. It's great for sedation. It's also great for pain control. It can be used in literally every aspect or every aspect of anesthesia. It's great for ortho cases. It's great in OB cases.
Yes.
It's great with general and even like the just deep sedation cases.
It's a great drug. So for IV induction, it's milligrams.
Mhm.
One to
It's 0.5 to 2 milligrams
Okay.
per kilogram.
there you go.
We do everything. We do everything in anesthesia. Everything is weight based,
Yes.
and it's on the metric system. So we're going to say kilograms instead of pounds.
Mhm.
The conversion is 2.2. Divide your
Yeah.
pounds by 2.2.
There you go. Ooh,
You
she's
get
smart.
kilograms. But there was a case. 23-year-old. His name was Elijah McClain.
Let's talk about it.
So just to give you just a little bit of background about ketamine is a drug that is being used by paramedics
Mm.
for sedation in conjunction with police officers. And the reason why we mention the dosages that we use is because in anesthesia is probably the only profession where you're going to see the amounts of medication that we give are amazing sometimes.
Yes.
But we give those medications knowing that we are monitoring your vital signs, we're monitoring your breathing, we're monitoring what your heart is doing, we're monitoring all of that.
Mm-hmm.
So for you to use these medications without that, it can be very dangerous.
Yeah.
I remember when I was a nurse working on the floor, I got dinged one time by a pharmacy, and they were like, "What in the world are you doing? Because you're giving a whole bunch of narcotics." But at the time, I was recovering hearts, and I was recovering hearts every single day.
Yeah.
It required me to use a lot of narcotics.
fentanyl.
Yes, and they picked up on that, and that's what they said. They were like, "Nobody uses this much except for anesthesia."
Mhm.
I guess I knew I was destined for anesthesia.
Well, the thing I want to add about ketamine, we use it in a lot of surgeries. It's a great drug to give during OBGYN. So epidural fails. Epidural can fail. Your spinal can fail. They're about to cut mom.
Yes, they are.
Usually, you give a dose of epidural. You can dose it up with ropivacaine,
Yep.
and
It's one of those.
they get numb. But in some instances, mom will feel it. Maybe it's not working right now. Maybe the epidural's failed. Maybe the spinal is taking its time getting to where it's supposed to be. So they won't remember,
Mhm.
maybe, because there's certain drugs we can't give while baby's still inside of mom.
But the Azalam is one.
Yes, so we can't give Versed. Versed usually causes amnesia. And if this patient has no amnesia, they're going to remember what happened to them.
Right.
So I've had instances where we go in, we put in an epidural, we put in a spinal, it failed.
Yeah.
It happens. So this drug ketamine, you give them ketamine.
Yeah.
So because surgeons coming with the knife regardless,
Yes, they are.
and they will, some of them are good.
Yes.
They'll take forceps
Mm-hmm.
and they'll
Text you.
test you and they'll pinch. And when they pinch,
They are pinching.
when they
hard.
pinch you, they pinch hard and they
Yes, they
grab
do.
your skin and pull. And you're gonna holler, and some of them do. They be like,
Yes.
they will scream.
I feel it.
I feel it. That's when you come with the ketamine.
Yeah.
Great 25, 50 milligrams of ketamine will put the patient out. They can have surgery.
Say it again. How much?
25 to 50 milligrams
All right.
of ketamine will do great for surgical anesthesia for OBGYN surgeon to pull a baby out.
Right.
That's to fully cut across the stomach, pull placenta,
Yes.
cut it,
I mean,
pull
they do
baby out.
this.
Yes,
I mean, they do
with forceps.
pulling.
I've
Yes.
seen shout out to Dr. Mika Cross.
Mhm.
I worked with her.
Mhm.
She's a great doctor. She actually just wrote a book too.
Mhm.
She's not paying me to do this, but
Okay.
I work with her LBJ. She's a great doctor. A couple of great doctors that work there that I worked there with. Andrea Alexandria, Dr. Cross. But they're doing great things in the community. They have their own business, and they're doing well. But ketamine works great. You give them the ketamine, no more pain, blocks of pain, baby's out.
Yep.
We're good, right? But we're not giving doses where you have the instance with Elijah McClain,
Right.
where this young kid was given 500 milligrams of ketamine,
500
which I don't care. You know, paramedics, you know, I don't think they should have ketamine. It's a dangerous drug to have if you don't know what you're doing with it.
Yes, it is.
Because to my knowledge, you can't reverse that drug. So
No.
you can reverse fentanyl.
Fentanyl? Yes.
You can reverse that. You can
Yes.
reverse morphine.
Yep.
You can reverse Versed.
Yep.
Now, with flumazenil, you can reverse the others with Narcan.
Right.
But ketamine, you give that, you're in trouble.
Yep.
And if you're not looking out for the signs and symptoms that could happen because a paramedic is not used to giving things
Right.
like this, even though they give drugs, it's great paramedics, but that drug should not be given
No.
by a paramedic. 500 milligrams to a little kid, it's going to put you out.
He was 140 pounds.
140 pounds.
I mean,
Yeah.
tiny.
So if you do the calculations, and they say they usually give 5 per milligram.
Yeah.
So, you know, if you do look at it for IM, you know, you can give 5, you know, but that's for induction of anesthesia.
That's when induction.
So induction of anesthesia is we giving you these drugs to put you to sleep so we can grab a laryngoscope
Yep.
and put a tube in, which controls your breathing. We hook you to an anesthesia machine and it breathes
Right.
for you. Not you giving it and you thinking it's going to calm them down.
Mhm.
And they say that, hey, we're giving it if the police officer can identify and see the patient is in delirium. Is it excited delirium, I
Excited
think?
delirium,
Something like
yeah.
that. Where they can give it. Well, the paramedic is not a doctor.
No.
Even the police officer is not a doctor.
No.
So that drug should not be given to these patients who probably, besides Elijah McClain, who they say he had psychiatric history. I don't know his history. But let's say if he did, right? So some drugs should be given.
No,
With some
I can think
drugs.
of 3 drugs right off the top of my head
Mhm.
that they could have given him
Mhm.
for an excited delirium. And
Mhm.
when we say excited delirium, think somebody that is high
Mhm.
off of
PCP.
PCP, you know, some hallucinogenic, you know, something that's gonna, mushrooms,
Yes.
think that, don't think how like, we think, how like, you're crazy going out of your mind.
Mhm.
I can think of 3 drugs. They could have gave Haldol, they could have
Mhm.
gave Judon, they could have given Ativan.
Yes.
I mean,
And these drugs will put you on your butt.
yes, and these drugs will do the opposite.
Yes.
Well, ketamine gives you what? It gives you an
Excited
excited
delirium.
delirium. Yes.
Yeah.
So it's called the K-hole.
Yes.
And anybody who has ever been in the K-hole,
Yeah.
they know it and they remember it because I've heard people tell me that it was like they were in a computer. I have heard
Mhm.
people say that it's a monkey in that corner and they
Mhm.
got to keep their eye on it.
Mhm.
I have heard like from all the bad stuff to all of
Oh,
the,
bad dreams.
good, yes, the bad dreams.
And that drug, one, I put a guy to sleep and he went home. He said the face kept coming out the wall, right? So I'm like, did it hurt you? He's like, no, it just kept coming out the wall. In other instances, we've seen this patient, they get ketamine, and when they have this ketamine, we tell them, hey, you need to think positive thoughts.
Yep.
Because if you think a negative thought or a bad thought,
It's about to amplify
it will go 10 times whatever. I've had several patients that say, I went to hell.
Yes.
And they come out of there and they change their life.
Yes.
Because it is a real stage 4, 5 rim drug. It will put you there. It is glory. It is blood splash. It is the
Yep.
worst dream that you can imagine.
Nuns at the end of the bed.
Yeah.
I mean, looking over you, and what is that movie where that nun was like coming and she was
Yeah.
killing the
Yeah,
people?
like,
Whatever it is,
Pretty
it's
bad.
too much. It's bad.
Clowns.
It wasn't the good nun. Yes,
But
Pennywise.
the thing is this, that drug causes hallucinations, like
Causes
majorly.
hallucinations,
One.
yes.
Two, it's a great pain control, but if I just told you that a surgeon took a knife, a big knife, cut you,
Mm-hmm.
pull a baby out, and you
Mhm.
sitting there looking at me and carrying on a conversation, that drug is a powerful drug.
Yes, it is.
And that is with a cut. Imagine you not being cut or excited to that end.
Right.
You're gonna be at another level. You're gonna be crazy. You're gonna be thinking crazy thoughts. Your eyes, they keep moving. That is nystagmus. That is a side effect of it.
Yep.
You can tell that it's actually working. As soon as you give the drug, their eyes start doing this, and they keep moving, and they like, oh my goodness, wow, this is so great.
Yep. And you see them start looking
Yep,
around.
you start looking around.
Yep. And but like all of this is real still, but it's, you can just tell that they are seeing something,
Mhm.
you can just tell. But that's the reason why I wanted you to make a point of saying, 25 to 50 milligrams, that's what you give these people in
Yes,
OB,
yes.
to pull a whole child out.
Mhm.
And we're talking about Elijah McClain, they gave him 500 milligrams.
Yeah.
And
140 pounds.
140 pounds.
Mhm.
And he was not having surgery.
Yes. He stopped breathing.
Right, he stopped breathing. And even as anesthesia providers, like we give something to help with the K-hole
Mhm.
so that it's not so severe, so that it's not, because, for the people who it's scary for, if they can come up off the table, they would try.
They would.
They would try. And I mean, you got to think about it. That's got to be a terrible place to be
Yeah.
right then. But, we give something to help combat that. And we can do that because guess what? We got control of your airway
Mhm.
and we can do whatever we need to do.
And we call them benzodiazepines.
Yep.
So we give benzodiazepines with these drugs, and it's great.
The paramedics are not doing that.
They're not doing that, and it sends them to a level that you cannot control them. And I don't know if it's influenced by law enforcement, or they don't. Honestly, I don't think they know what that drug and how the side effects of that drug. What happens, like Elijah McClain, you give him that drug, he is going to lose his mind.
Yep.
500 milligrams, he will lose his mind if he don't have a heart attack.
And
So, because it excites and it makes you go crazy. You
Yep.
can't touch him. If I can cut you and nothing hurts, you can tase me and it's not gonna hurt.
right.
So that's the point I'm trying to make.
Mhm.
So what's causing this influence? Is it the officer saying give it to him, and he's seen in instances that they act crazy, which
Right.
will cause him to tase him,
Mm-hmm.
which will cause you to shoot him,
Yes.
which will cause him to keep tasing to a drug that raises your heart rate, raises your blood pressure. You tased them. The taser can stop your heart.
Yep.
And all these things that start to happen, it's like it's a cascading effect. There's a ball rolling down the hill. It's
And it
not
snowballs.
Yeah.
And it gets worse and worse and worse.
Mhm.
And like this young man, he lost his life.
good. Yeah.
And,
How many undocumented people lost their life?
we'll never know
We won't.
because it's undocumented. They
Mhm.
showed up at the hospital, DOA,
Mm-hmm.
or, who knows what, the story was once they got to the hospital,
Mm-hmm.
because,
Yeah. They come in there. They've been shot. They've been this. They've been that. And
Yep.
it's like they call anesthesia down, and you sitting there, and you looking at him and like, this dude is dead.
Yeah.
He like
dead.
gray.
Yes.
Like you see a African American man that's gray. I ain't talking about gray hair. I'm talking about gray skin. You like,
And African American people can turn gray.
yes, they can.
They can turn gray.
Yeah, you see a Caucasian fella. He blue. He coming in there. You like, what are we doing?
Nothing but looking at it.
Yeah. So
You're going through the motions at that point in
yeah,
time.
you like, oh, you want me to put a tube in?
Okay.
I ain't even gotta give him no drug. He's just as dead as a doorknob.
At that point in time,
But-
nothing's gonna move.
The drug is wonderful when it's used by anesthesia.
Mhm.
So I guess this is an instance where medical professionals that's trained to give this drug is great. Like propofol. Propofol got such a bad name because of
The Michael Jackson.
Michael Jackson, right? We don't want to discuss the doctor that gave it. Everybody know his name too. But the thing about it, propofol is great. When it's used right. Because if me and you would have put Mike to sleep, Mike would still be hitting it. Yeah, Mike would still be
be on tour right now,
Mike
you
would
know.
still be on tour. He still be kicking, but you know we won't say his name, but we will say his profession. He was a cardiologist.
Yes,
And
he
he
shouldn't
was-
have been handling that drug.
He shouldn't have been handling that
Yeah,
drug.
especially at home.
Yes.
So,
on the
which-
phone.
yeah, and our profession would have said no. So that probably what happened. He probably called an anesthesia guy. You know, I don't know if Mike wanted one. He probably, looking
he
at his
probably could
stuff.
afford it.
Oh, he can afford it, but these drugs that we give are very powerful. They are hundreds of times powerful than these drugs that you normally take, like morphine or anything that's kind of like that.
The Percocets,
Yes.
the Norcos,
That ain't got nothing on what we give.
nothing.
You know, they be talking about Tony Montana and Pablo Escobar. We are the Pablo Escobar, my friend. We got it. We got
are
the
the
yayo
Pablo
for real.
Escobars of the
Yeah.
anesthesia world.
So we
Shouts out
have
the
the
hospital.
drugs.
Of the
Yeah,
hospital.
From the hospital. We have the drugs, and you're not gonna come in there and beat us
No.
because we got a whole drawer, whole Pyxis, whole everything full of drugs. So you fighting a losing battle. You come in there. You come in. It's just like you come in their stories. You come in the emergency room talking loud. You know, they call us down there. You finna go down, buddy.
If they call anesthesia
We're not finna play
to
with
come
you.
down, we're not playing.
No.
We don't have. I think the mentality and the mindset is we don't have time to play with you.
Yeah.
If you called us, that means somebody needs to go to sleep. Somebody needs to take a nap. Somebody needs to rest. Somebody needs to breathe more efficiently. And we like to do it the way we like to do it, and which is we like to control everything.
Mm-hmm. But we're gonna conclude this. We're ketamine, great drug.
Yes.
Next week we're gonna talk about something else. We're gonna talk about awareness, and we're gonna talk about a lot of other things. You know, check us out on YouTube, Instagram. You'll see it flash across the screen. Thank y'all for joining us. Vascular anesthesia, insomnia.
Sleep well.
Sleep well.